Okay, so for child delivery to be said to occur, we have different stages in which this thing usually comes through. Okay, we have the first stage, we have the second stage, we have the third stage. Now for each stage, there are some things that you should keep in mind, so that, yes, just to make sure that each stage goes on as planned. Okay, so for the first stage of labor, we're now trying to look at the management is more of like things you should keep in mind, things you should keep in place for that stage of labor to go on as planned. So for the first stage of labor, we said that it usually begins with the onset of regular uterine contractions, and it ends when the cervix is fully dilated to 10 centimeters. So if you are managing that stage, you are ensuring that the mother is doing fine, you are ensuring that the baby is also doing fine, you are ensuring that delivery is going on as planned. So the goals of monitoring that stage is to ensure that labor is progressing, the mother is safe, the baby is safe, okay, everything is going on. You are preventing any complications from coming up. So key components of managing the stage is you are always accessing and monitoring both the baby and the mother. Okay, so you are checking for vital signs of the mother, the blood pressure, the pulse, the temperature. On the baby side, you are just trying to make sure that the baby's heart rate is within range. Okay, cervical examination, you are looking at how the cervix is becoming thinner. Then you are plotting everything you are seeing on a partograph to see how the graph is going, okay, to dictate any abnormalities. So supportive care, that's emotional support, mobility, you encourage walking, hydration and nutrition, pain relief if the pain is too much. Then bladder and bowel care, just make sure that the woman empties the bladder to prevent any obstruction when the baby is coming down. Okay, also avoid constipation. So the environment should be calm, should be private. You don't allow outsiders to come and see our nakedness. That's why in our place we don't allow people into the labor ward except medical students who will soon be doctors too, and nurses. So medical intervention, they can artificially just rupture the membranes to accelerate the labor. Okay, they can give oxytocin to make sure that the contractions are much more frequent. Okay, then antibiotics, they can give this just to prevent any infections from bacteria, okay, during that time. So for the first stage of labor, these are the things that you keep in place to make sure that this stage goes on as planned.